out of 4 children. 60% of the children who struggle with reading have vision problems. Many children with learning-related vision problems have 20/20 distance eyesight, but have great difficulty doing vision tasks less than 1 arm's length away. I have suffered with undiagnosed vision problems my entire life. It does cause physical and emotional problems. Your regular eye doctor does not do this type of comprehensive testing because they have no plan for it if they find it. What your regular eye test does is it tests for clarity, checks for the eye health, and any lens modifications that need to be done to compensate for refractive errors such as nearsighted, farsighted, or any astigmatism. It does not, however, check to make sure that your eyes are actually working. Health of the eye checks the structure of the eye, as I said, the surrounding tissue, and it does that pressure test, which we all love when you blow the air in your face. That is actually for glaucoma. It tests the pressure in your eyes. It also can determine any damage to the retina and if there's any medical problems such as diabetes. Your clarity check checks your eyes to see how clear they are. That's one of the tests that they check for to see if there's any cataracts or not. And then again, it does, what your eye doctor does is he checks to make sure how well you see at a 20/20 vision. And when they do that, they use something called a Snellen chart, which I'm sure you've all seen. This is over 100 years old. All it does is it tests that you can see clearly 20 feet away. It does not test anything else. Unbeknownst to me before I started this. Okay. Again, 20/20 vision is considered to be the standard. Many eye problems can still exist and can lead to learning and behavior problems. A comprehensive eye exam will include additional tests for eye tracking, binocular vision, stereopsis, and convergence and eye teaming skills, which will tell the doctor if your eyes are working together or not. Eye tracking is the ability to follow an object. That's when they usually take a pencil and they go like this. Binocular vision tells if your eyes are actually working together. And think of a pair of binoculars where you look through both and you get one picture. Stereopsis determines if you can see in 3D. Generally, the way they test that is they give you that book and they say which of these is up. Convergence and eye teaming determines how well your eyes are actually working together to focus on an object. One of the ways that your doctor does that is when he covers your eye, he checks to see how much they react in coming back to focus. The problem with this is that there are no symptoms or signs, and if it's not taken care of, your brain can actually turn off one eye. The way your eye works now is it sees 2 pictures. It sees one with the left eye and one with the right eye. It comes into the brain makes one picture. If your eyes are not working properly, this one can either be in or out or up or down. Your brain gets 2 pictures. And of course, the brain can't figure out what to do with them, so it turns one eye off. You can still see, but your brain's not receiving a picture. Okay? One of the exercises that I had to do is called a Brock string. And it's literally a piece of string with a ball. And you hold it on your nose, and then you look at the ball, and what you're supposed to see is what I have in this picture. 2 strings going in, 1 ball, 2 strings going out. When I first started this, it didn't happen. I had this ball way over here, so I had 2 balls, and this string disappears. And the reason this string disappears is because of this eye. Okay, so when you're scheduling your yearly eye exam, I would highly recommend that you get a comprehensive eye exam with a trained vision therapist. The way you will know if they're actually trained is they'll have 4 or 5 extra letters behind their name. There is, as I said, more to seeing than just your vision. Your brain, 80% of your vision is not your eyes seeing, but your brain interpreting it. So if your brain's not getting the correct message, it can't interpret it. The other thing that is this causes is depth perception of film and 3D. You can't see in 3D. If you watch a 3D movie and your eyes were this way, you would go, yeah, what's the big deal?
Hey ladies, cheese on the salad?
You should stop. As I said, I went through 6 months of visual training. When I first started, I could not see the balls on the string. I was getting massive headaches. It also contributes to hand-eye coordination, which makes sense why I like to play ball. It also contributes to errors in your work. Because your eyes, you think you're seeing something, and your eyes are seeing something different than what you think you're seeing. When I spoke to Krista Slanker-Roser, who is my doctor, I asked her several questions, one of which was, why did she do this? And she said after she learned about it, she had no choice. She had to do this. She had to help people. It was rather strange because when you go to therapy, 99% of these people are children. And they can, because their hand-eye coordination is so good, they can do the test better. So I always felt like a dummy. And that is part of the problem as well. There is a book that was written, it's called How Behavioral Optometry Can Unlock Your Child's Potential, Identifying and Overcoming Blocks to Concentration, Self-Esteem, and School Success with Vision Therapy. The problem with this is that people will label children as lazy or not working up to potential, where the only problem is that these kids can't see and they don't know that they can't see. So I hope this has been informative. Does anybody have any questions? And again, I will highly recommend that you go have a vision test done.
I have a question.
Yes.
What special tests did they do above your normal test to determine that you had this?
My test was over an hour, and when I got done, my eye literally hurt. I felt like I'd been working out at the gym with my eyeball. Part of what they do is they have me follow things. They also had me 2 pictures and here, to see how quickly you react. The Snellen chart, they put it at the wall, and they literally, when they put the glass things on, they separate it. They, on purpose, make it 2. And then as she brings it in, she asks how long it takes for me to actually bring it in. And part of, when I first started, was that my eyes couldn't do that. Now, my eyes can pull it in very quickly. But all my life, when they did the red and green, I could never keep them straight. When it was half red and half green, they'd always go like this, but nobody ever did anything about it. They also had me tracking lines on a paper. I did the same thing that you do with the 3D, but I had to do it all 9. And when I first started, it was like, what happened? You can't see it. And then this one over here is a bug, and you tell them where the bug wings are, because that's your 3D. I also had to take a piece of paper that had an X in it, and her light, that light that they always put in your ear, and I had to mark it here. When I first started this, I couldn't get anywhere near the center. And in 6 weeks' time, I had it almost to center, and in 13 weeks, I had it at center.
But what did they do that set up that flag to go further with this testing? Was it glaucoma issue? Was it age? Was it your eyesight was decreasing?
I was sitting at work at home, working on my computer, And when I get tired, I always shut this eye. So I was in the back, working on the computer, shut this eye, came out, standing in the hall, and something doesn't seem right. So I shut this eye, I could see, and I shut this eye, and it was black. I didn't think anything of it because it only lasted about 5 minutes, but after I talked to people, they said that's a sign of a stroke. I started getting a lot of double vision, so I went to the doctor. He then referred me to a specialist in Baltimore, and that man spent an hour and a half testing my eyes with prisms and testing them. And he did the dry eye test, he did everything. His recommendation was that I go for vision therapy, and if that did not work, I would have to have eye surgery.
How long did you go for your vision therapy?
I went for 6 months. I just went for my yearly checkup, and she told me I'm doing well enough that I don't have to come back for another year.
Good. Very good.
But I do know it's something that the tests, the exercises that I do, I will have to do the rest of my life. Because I know now when I get tired, my eyes start to wander, and I wind up closing this one again. But